1997, I became a certified clinical nutritionist. So I became the pharmacist to go to if you wanted to get off drugs or not go down that road to begin with. So I've been exploring different ways to heal for quite some time now. Here is my bio if anybody needs it. And tonight we're going to talk about nitric oxide and how EMF decimates our ability to make nitric oxide and what happens to our physiology when that happens. So we're going to start with the basics of nitric oxide so that we're all on the same page and so that everything kind of makes sense. So nitric oxide governs circulation and microcirculation, has everything to do with learning and memory. Our kidney function is nitric oxide dependent. Our vision, our eyes, our hormones have to have nitric oxide in order to even start being made. Our immune system, our first defense is nitric oxide. Our lungs, our sexual response, all assets of fertility are nitric oxide mediated. And here's what EMF does. EMF touches every single physiological process too, and everything that EMF affects is nitric oxide mediated. The cardiovascular, diabetes, all of these things that EMF affects has to do with nitric oxide at the base. So EMR, electromagnetic radiation, these are the waves of electric and magnetic energy moving through space together. EMF means it spans large frequencies. And if you change the electrical charge, you are going to change biological processes. You get quantum decoherence and loss of energy efficiency. And in fact, like the safety standards for EMF exposure was last updated in 96. And it's the non-thermal effects of this EMF that does the damage. See, one of the reasons they haven't updated those standards is because they say EMF doesn't cause the thermal reactions, doesn't heat up the cells. Because they think, they try to get us to think that that's the only thing that can cause damage. But actually, these EMFs increase oxidative stress, and it throws off that redox balance. And when you got increased oxidative stress, you downregulate the production of nitric oxide. And oxidative stress plays a role in all chronic degenerative and inflammatory issues. Every single thing that goes wrong at the base is oxidative stress. So we don't feel these EMFs. These are non-thermal things that are happening in our body. This oxidative stress, we don't feel that. So why is nitric oxide so essential? Regulates all cardiovascular function and homeostasis. It governs circulation and microcirculation. Hemoglobin requires nitric oxide to be attached to a cysteine molecule on it in order to deliver oxygen to the cells. So you could be supersaturated with oxygen, but if you're nitric oxide deficient, you're not going to be able to deliver that oxygen to the cells and tissues. Supports neurotransmitter function, regulates gastrointestinal function, including gastroparesis, healthy mucous membrane layer, healthy microbiomes everywhere. The GLUT4 receptor on the membrane of the cell has to have nitric oxide in order to translocate to bring glucose into the cell. It's essential for learning and memory, supports mitochondrial biogenesis, controls the efficiency of the mitochondria in the generation of energy and the generation of hormones, where cholesterol gets metabolized into pregnenolone, the mother hormone. It's essential for sexual function in both men and women. It's required for stem cell mobilization and differentiation. So nitric oxide is required for those stem cells to go where they need to go and do what they need to do. In fact, if you're doing any kind of stem cell therapy, make sure they're nitric oxide repleted before you do that, and they will have much better results. Regulates the immune system function, regulates inflammatory response and scavenges free radicals, modifies platelet activation and aggregation, which is so critical in today's post-viral, post-jab world. That spike protein decimates the nitric oxide bioavailability, and that's why all these people are having these little microclots. And supports telomerase activity, which has everything to do with longevity. So we make nitric oxide through two pathways. One, the NOS pathway, takes arginine and oxidizes it into nitric oxide. This pathway is very sensitive to numerous factors. It's pH dependent, oxygen dependent, your flavins, NADPH has to be there, iron, BH4 is what keeps that NOS coupled. And then the nitrate to nitrite to nitric oxide pathway, which is so essential to support, because as we age, our ability to make nitric oxide decreases. Us women hold on to it a little better than men until we reach menopause, and then it kind of evens out. So by the time we're 40, our ability to make nitric oxide is only functioning about 50%. By the time we're 60, it's only functioning about 15%. So that's why it's so critical to support the nitrate to nitrite to nitric oxide pathway. So we talked about aging, diet, standard American diet, devoid of essential cofactors, nutrients, devoid of nitrate-rich veggies, the lack of exercise. And what we can't see here is like medications. So antibiotics, antifungals, SSRI antidepressants, birth control pills. That's why they don't want women over the age of 35 taking birth control pills, especially if they're a smoker. It's because this nitric oxide connection. NSAIDs, PPIs interfere with the production of nitric oxide through both pathways. EMFs, pollution, anything that increases oxidative stress, uncouples that NOS enzyme. Glyphosate is everywhere. Genetics, and not just your NOS SNPs. Any SNP that increases oxidative stress, maybe your SOD SNPs, catalase SNPs. If you have any MTHFR SNPs, you are by definition nitric oxide deficient, because you're unable to adequately make BH4, and BH4 is what keeps nitric oxide, the NOS enzyme, coupled. And then the last one is stress, the big one, stress. Stress uncouples that NOS enzyme. And what uncoupled means, like NOS, for NOS to function, it's got to be coupled. It's a dimer, and it's held together by BH4, tetrahydrobiopterin. So when it's coupled, that electron from NADPH is handed on down to arginine and then oxidized to nitric oxide. When NOS is uncoupled, that electron is not handed down to arginine, it's handed down to oxygen and makes superoxide. So when NOS is uncoupled, it is a superoxide generator, not a nitric oxide producer. So the rate limit cofactor is BH4, is what keeps it coupled. If you're giving arginine to a BH4 depleted uncoupled NOS, you're actually increasing superoxide production. So arginine supplementation is not effective in the aging population or anyone with a chronic issue. Most of the studies done with arginine showing that it increases nitric oxide were done on young, fit male athletes. And vitamin C is the only molecule that can reduce BH3 back to BH4. So if you are vitamin C deficient, that BH3 oxidizes to BH2, BH2 uncouples NOS. So then if you're supporting nitrate, this actually helps support that NOS enzyme too, because the nitrate will inhibit your NADPH oxidase enzyme, which decreases oxidative stress, and it allows that NADPH for other needed processes. Nitrate upregulates the production of BH4 by increasing the enzyme GTP cyclohydrolase. BH4 helps recouple NOS, increasing nitric oxide, decreasing superoxide. It increases the activity of SOD and catalase. So we are really decreasing oxidative stress by supplementing nitrate. So we've got three main ways we make superoxide in the body, and supporting the nitrate to nitrite to nitric oxide pathway downregulates those three main sources of superoxide. So that's uncoupled NOS, your NADPH oxidase enzyme, and uncoupled mitochondrial electron transport chain. So oxidative stress and inflammation is at the base of every single chronic issue. So this NADPH oxidase enzyme, whose only job is to make superoxide, gets upregulated by a lot of these environmental factors: mold, infection, inflammation, oxalates, histamine. But EMF is a big one. EMF, that's how EMF starts this oxidative stress process. So when that NADPH oxidase enzyme is upregulated, it will preferentially steal that NADPH, resulting in like less being bioavailable for fatty acid synthesis, steroid synthesis, phase 1 detoxification. You're not able to recycle your oxidized glutathione. And remember that NADPH is part of that NOS enzyme too, and supporting the nitrate to nitrite to nitric oxide pathway down regulation.
Can I a little bit interruption here, and I'm sorry for that. NATCH, I think it's NOx. NOS is nitric oxide synthase, which is something we wanted. But no, NOx is the NATCH.
NOx is NADPH oxidase.
Right, but before what you did NOS, right, as NOx.
No.
Okay, sorry for that.
No, see?
Okay, yeah, okay. My eyes.
Okay. So when this NADPH oxidase enzyme is upregulated, it stimulates RAS. So you're increasing cardiovascular disease, you're increasing diabetes, insulin resistance, you're impairing your thyroid function, you're inflaming your gut, you're impairing cognition, you're impairing the kidney function. You got a vicious cycle of inflammation everywhere. So Martin Pall, he's got a theory out there that EMF damages tissue because it increases peroxynitrite. And so I'm going to address this peroxynitrite issue. So he believes that the EMF increases, stimulates the voltage-gated calcium channels to increase the influx of calcium into the cells. And when you do this, he thinks it stimulates your calcium calmodulin dependent NOS, which is your eNOS and your nNOS. And he thinks that increased NO from that reacts with the superoxide to increase peroxynitrite. So he's thinking that peroxynitrite mechanism is what's injuring the cells and tissues. However, the data is severely limited on that. Nitric oxide may be present. However, this does not mean that nitric oxide is causing the issue. Just like when you have a fire, there's always firemen in the area. That doesn't mean the firemen are causing the issue. So nitric oxide may be present, but it doesn't mean it's causing the issue. And in fact, when you read these studies, and it's talking about peroxynitrite, if you read them, look at the wording on it. They're always saying, we're suggesting that peroxynitrite. It may be peroxynitrite. But they are actually measuring nitrotyrosine. They're not measuring peroxynitrite. They're measuring nitrotyrosine, and they're assuming peroxynitrite was formed. However, nitrotyrosine is not specific for peroxynitrite. In fact, there's a new paradigm in the nitric oxide research community saying that this peroxynitrite isomerizes to nitrate, because look, they're both, 3 oxygen and 1 nitrogen. And peroxynitrite in the body pH is in equilibrium with peroxynitrous acid. Peroxynitrous acid is unstable in aqueous solution and isomerizes to nitrate. Peroxynitrite reacts with oxyhemoglobin and isomerizes to nitrate, 90 to 95% of it. Your enzyme peroxyredoxins, this is a significant biological sink of peroxynitrite, metabolizing it to nitrate. And in fact, there's actually some studies showing this peroxynitrite can be beneficial. It reacts with glutathione to form the N-nitrosothiols, which is a storage form of nitric oxide and glutathione. They've shown where peroxynitrite can inhibit lipid peroxidation. But you will actually inhibit the formation of peroxynitrite by increasing the production of nitric oxide. Because in general, if you're making a lot of superoxide, because peroxynitrite is nitric oxide and superoxide. If you're making a lot of superoxide, typically not making a lot of nitric oxide, because superoxide shuts down nitric oxide production. In fact, there's one study right here, role of nitric oxide as a mediator of GI mucosal injury. Say it ain't so. I love this study because they dig into this. They say it's controversial whether increased nitric oxide from iNOS or any other source damages tissue. They use a NOS inhibitor called LNAME, and they do see a decrease in tissue injury and inflammation. However, this might not be due to the inhibition of quote unquote cytotoxic concentrations of nitric oxide. There's other actions of LNAME that may be at play here. In fact, they say large amounts of nitric oxide does not do damage to the mucosa or the vasculature. Another source of oxidative stress, your mitochondria. Not all the oxygen consumed is converted to water. And about 2% is converted to superoxide. However, more is converted to superoxide when the mitochondria get uncoupled under inflammatory conditions and oxidative stress. In fact, the cytochrome C oxidase enzyme within the mitochondria can become a nitrite reductase enzyme to reduce nitrite to nitric oxide on an as-needed basis, to open up the circulation, because blood flow to the cells is more important than how much oxygen is carried by hemoglobin. Nitrite and nitric oxide recouple that electron transport chain, decreasing proton length. Nitrite and nitric oxide stimulate hypoxic mitochondrial biogenesis by activating AMPK and SIRT1, and thus activating PGC1 alpha. EMF causes extensive electron leak from the electron transport chain. It uncouples that electron transport chain, increases the oxidative stress. So what I mean by uncoupling is, instead of sending that electron down and making your ATP and your water, that electron gets leaked and starts making like more reactive oxygen species. AMF downregulates your antioxidant genes, your SOD, catalase, glutathione peroxidase. You actually lose the ability for beta oxidation of fats in the mitochondria with EMF. Blue light exposure and EMF, hypoxic. Remember, oxygen is an essential cofactor to that NOS enzyme. So EMF stimulates that NADPH oxidase, uncouples that mitochondrial electron transport chain, uncouples NOS, increases the activity of myeloperoxidase, increasing hydrogen peroxide, stimulates a Fenton reaction, so you've got more hydroxyl free radicals in your Fe3 plus, increases that influx of calcium ions, which then goes on to stimulate that NADPH oxidase enzyme more. So the gene that encodes that voltage-gated calcium channel is CACNA1C. This gene, if you've got SNPs in it, gives you increased sensitivity to EMF. So you've got excitotoxicity. And coincidentally, this gene is also associated with bipolar symptoms, schizophrenia. But supporting the nitrate to nitrite to nitric oxide pathway addresses every single one of these issues that EMF is stimulating. So these voltage-gated calcium channels, these are widely distributed within the CNS. And when they're stimulated, this change, quantum coherence change, you lose that membrane potential, causing the proton links. You decrease ATP synthesis. You increase that mitochondrial uncoupling. You weaken neuronal integrity. You get a breakdown of that cytoskeleton. You get cytosolic shrinkage, dehydration of the cell. That's because that mitochondria is uncoupled, so you're not making that water that the cell needs. And that water is that deuterium depleted water. So it's really a special water that cell needs to function. It activates the NMDA receptor, which is a component in inflammatory and neuropathic pain. GABA can inhibit that, and actually nitric oxide can increase GABA to inhibit that. But stimulation of these calcium channels is part of the pathophysiology of CNS disorders, including Alzheimer's, Parkinson's, and MS. So nitric oxide and nitric oxide donors inhibit that influx of calcium from the voltage-gated calcium channel. It regulates the intracellular calcium concentration. So it will blunt that mitochondrial calcium overload without undermining ATP synthesis. Exposure to Wi-Fi increases heart rate and blood pressure. They've known that these EMFs affect blood pressure, increase diabetes. They've known this. The Russians knew it in the 50s, and in US, they didn't really figure this out till the 60s, but they've known this for a long time. So it increases arrhythmias, increases hypertension and dyslipidemia, stimulates that RAS cycle. Nitric oxide down-regulates that RAS cycle. So nitric oxide regulates all mechanisms controlling that intracellular calcium concentration. EMF is classified as an immunosuppressant. It causes a biological stress response, down-regulates the production of nitric oxide. Nitric oxide is our first defense against pathogens, against virus, fungi, bacteria. EMF alters the gut-brain immune axis. That increased calcium influx increases cytokine storms, which increases susceptibility to these pathogens. EMF intensifies our reactions to mold, Lyme, virus, bacteria, parasites. It kind of just supercharges them. In fact, prior to this last viral thing, Where the virus really took hold initially are in the places where they just rolled out the 5G. So there's all kinds of studies showing the connection with the virus and EMF. So EMF exposure dysregulates our immune response. Remember that 80% of our immune system is our gut, and we will talk about how nitric oxide is in our gut. So nitric oxide makes a healthy mucous membrane layer, downregulates mast cell degranulation and histamine release, downregulates a cytokine release from macrophages, increases formation of new blood vessels, vasodilates, accelerates wound healing, reduces adherence and secretion of the neutrophils, and decreases oxidative stress. So supporting the nitrate to nitrite to nitric oxide pathway will protect that microbiome. It prevents or reduces dysbiosis and actually stimulates eubiosis. And all of our microbiomes are connected. And the nitrate actually supports the microbiomes everywhere. These tight junction proteins that we get in our gut, our blood-brain barrier, kidney, skin, bile duct, lung, they're responsible for the integrity. And when we lose these tight junction proteins, we get a breakdown of the barrier. You get leaky gut, leaky brain. You see decreased expression of occludin and claudin 5. Nitrate actually helps increase the production of occludin and claudin 5, decreasing leaky gut, decreasing leaky brain. BDNF also regulates intestinal barrier integrity. Nitric oxide is the essential mediator of BDNF. EMF stimulates mast cell degranulation. So all these mast cells are lining the mucous membranes, and they release histamine, cytokines, chemokines, interleukins, platelet activating factor. They're activated by superoxide. They're activated in the absence of nitric oxide. So nitrites, nitric oxide, regulate that mast cell, down-regulate the inflammatory events of that mast cell, decreasing degranulation, decreasing the release of histamine and cytokines, decreasing leukocyte endothelial cell attachment, decreasing the reactive oxygen species. EMF disturbs microbiomes everywhere. It increases antibiotic resistance. It enhances biofilm formation, decreases the good bacteria while increasing the harmful. The beneficial bacteria actually are growing slower. So supporting that nitrate to nitrite to nitric oxide pathway prevents that dysbiosis, supports healthy microbiomes, decreases inflammation, downregulates and scavenges reactive oxygen species. Nitrite can actually help disrupt that biofilm. And I'm reminded of a study that showed that nitrite with vitamin C did better on chronic urinary tract infections than broad spectrum antibiotics, because that nitrite can disrupt that biofilm. EMF, it alters every single part of the endocrine function, reproductive function, fetal development. So EMS is decreasing melatonin from the pineal gland, is affecting every step of fertilization, growing the baby. And this all starts because nitric oxide is essential for us to start making our hormones. So you need adequate nitric oxide in the hypothalamus to release your gonadotropin releasing hormone, or your LHRH, which then goes down to your pituitary for your LH FSH release, which then goes down to your ovaries and testes to make your hormones. your estrogen, progesterone, your testosterone. And these in turn, these estrogen, progesterone, and testosterone can go stimulate your NOS production of nitric oxide. So this is a good circle here. But as you can see, there's a couple hormones here that interfere with the production of nitric oxide. One is prolactin, and the other is glucocorticoids. So EMF is a powerful promoter of infertility. These non-thermal, high-penetrating destructive effects. You're disrupting that HPA axis. It's a biological stress response, increasing the cortisol. You've got an upregulation of sympathetics and a downregulation of parasympathetics. So when you're dysregulating that HPA axis and decreasing your gonadotropin releasing hormone, decreasing your LH and FSH, you are inhibiting fertility. It's inhibiting melatonin production, which is increasing oxidative stress. Melatonin also influences your LH and FSH. Most EMF studies were done on animals. However, there have been a few cases of spontaneous abortion and fetal abnormalities in pregnant women because you're inhibiting ovulation, decreasing number of corpora lutea, accelerating apoptosis in ovaries. You're not implanting correctly. You're interfering with the development of the embryo. You're decreasing sperm count, morphology, motility, and viability, disrupting the sperm mitochondria. Remember I said that EMF interferes with the mitochondria. In the sperm, there's only like 50 to 75 mitochondria. In the oocyte, in the egg, there's like 100,000 to 200,000 mitochondria. So with that EMF destroying the mitochondria like that, you're really inhibiting reproduction. So you're stimulating NADPH oxidase, you're increasing electron leakage, you're disrupting normal cellular process of the sperm, egg, and embryos. You're increasing that calcium influx, you're uncoupling NOS. The EMF increases the GI and the blood-brain barrier permeability and disrupting the microbiome, increasing leaky gut and leaky brain, and the health of the gut is intimately connected to infertility. And there's like the microbiome, there's actually, like a microbiome, of your vagina that needs to be healthy. There's a microbiome, of the male that needs to be happy. And this EMF is disturbing all of that. EMF increases hemoglobin A1C and diabetes. And some have called it environmental type 3 diabetes. And long-term, there's studies showing long-term exposure to cell phones increases the fasting blood glucose and insulin. And remember that EMF is a physiological stress response. So with increased cortisol, you're going to have increased glucose, increased blood sugar dysregulation, increased hemoglobin A1C. Hemoglobin A1C binds tightly with nitric oxide, making it not bioavailable. Nitric oxide is also essential for that GLUT4 translocation to bring the glucose into the cell. So supporting the nitrate to nitrite to nitric oxide pathway actually will support all of this. EMF impairs the blood-brain barrier. You've got altered integrity, leakage of albumin, neuronal cell damage. Those tight junction proteins are decreased and you've got breakdown of that barrier. Decreased expression of that Claudin and Claudin 5. Nitrate can help repair that. So one thing, like Dr. Klinghardt sees like some of the sickest of the sick, and all of his patients that come to see him, they have to clean up their EMF environment or he won't even treat them. And so, like they're poisoning our water with fluoride and heaven knows what. They're poisoning our air with the chemtrails. They're poisoning our food with the glyphosate. And then they're bombarding us with this EMF that's opening up the blood-brain barrier and allowing all of these chemicals to get into our brain. And then couple that with this, with that spike protein, people aren't thinking right anymore. EMF stimulates mTOR. And we're already swimming in the sea of mTOR stimulation, like iron, monosodium glutamate, pesticides, amino acids, xenoestrogens, estrogens, plastic, glucose, insulin. All of these stimulate mTOR. mTOR stimulates NADPH oxidase. mTOR drives cerebrovascular dysfunction by downregulating eNOS production of nitric oxide. mTOR inhibits AMPK and autophagy. And we know that AMPK is essential in glucose and lipid metabolism, in the mitochondrial health. And just as a side here, the last virus actually co-opted that mTOR and made the host more hospitable for replication. And here's that mTOR inhibiting eNOS, nNOS, causing like impaired cognition. EMF increases cell senescence. So there's been a lot of studies showing that decreased mTOR activity increases lifespan because it increases autophagy, the cleanup. So senescence is connected to atherosclerosis. You see increased oxidative stress from the cell phones. Remember that nitric oxide donors stimulate AMPK, which inhibits mTOR, allows autophagy. Study shows nitric oxide can prevent cell senescence, scavenges reactive oxygen species, and increases telomerase activity to restore telomere length. So oxidative stress and exposure to chronic EMF increases telomere shortening. By increasing nitric oxide bioavailability, you're actually activating that telomerase. You're inhibiting cellular aging, delaying cellular senescence. EMF, biological stress response, dysregulating that HPA axis, increased glucocorticoid levels, impairs the growth of the neural cells in the hippocampus. This is where learning and memory takes place. Increases heat shock proteins, which is a marker of cell under stress. Klinghart says that every cell in the body is on alarm state from this EMF. Cortisol downregulates iNOS. That's why when we're stressed, we get sick easier. Our immune nitric oxide is not available. Downregulates eNOS. That's why when we're stressed, we have more cardiovascular disease, more strokes, more MIs. Cortisol increases oxidative stress, decreases synthesis of BH4, increases blood glucose, increases hemoglobin A1C, which binds tightly to that nitric oxide. So this biological stress response decreases the production of or makes nitric oxide not bioavailable to do all the good things it needs to do. EMF in the thyroid. They see decreased T3 and D3/4. And when you have increased cortisol, you've got a decrease in the conversion of T4 to T3. They say increased degranulation of the mast cells in the thyroid. So in the thyroid, there's a couple of NADPH oxidase enzymes called DUOX1 and DUOX2. And they make like a specific amount of hydrogen peroxide that's needed for the thyroid peroxidase enzyme. Not too much, not too little. However, when you're stimulating these NADPH oxidase enzymes, your DUOX1 and your DUOX2 from EMF, you've got way too much. So nitric oxide and nitrites downregulate that NADPH oxidase and DUOX enzymes. And they even went on to say, like, supporting the nitrate to nitrite to nitric oxide pathway may be an underutilized therapy due to its role in decreasing the production of superoxide and optimizing nitric oxide levels. You know, like the cold hands, the cold feet that are always indicative of thyroid issues. Well, it's actually a deficiency of nitric oxide there. EMF interferes with sleep. You see a phase shift of the circadian rhythm. You see a disruption of the brain activity, increased blood-brain barrier permeability, increased cortisol, decreased melatonin. So this circadian rhythm, which is high cortisol in the morning, going down, and then melatonin starts up in the evening, you see a phase shift of that. Because all these people with this, all these like devices and stuff, just, you know, still, you know, in the evening, keeping that cortisol level up. So the melatonin then can't be brought up. And most of the melatonin is actually made within the mitochondria, only about 5% in the pineal. So that gut health is essential. There's a study that showed that constant light exposure in the pineal decreased NOS activity 80% after 8 days. The nNOS production of nitric oxide in the neurons of the brain signals sleep and sleep patterns. Nitric oxide modulates a circadian rhythm. And you're decreasing this melatonin, which is a potent free radical scavenger. Melatonin induces eNOS, nNOS, downregulates iNOS, stimulates glutamyl cysteine ligase, the rate-limiting step in making glutathione, inhibits NADPH oxidase, stimulates SOD, decreases ADMA, because ADMA downregulates NOS production. ADMA is connected to all-cause mortality. Decreases pro-inflammatory mediators. It's protective against mercury. It's beneficial in non-dipper hypertension, protective and obstructive sleep apnea. And this has to do with nitric oxide helping to modulate that mitochondrial circadian cycle. EMF can increase anxiety and depression. You've got these voltage-gated calcium channels throughout the nervous system. And when they're activated, they're excitotoxic. So these EMF waves can increase depression, anxiety, irritability, sleep disturbance. When you're not sleeping right, nothing goes right. Creates neurotransmitter imbalance. You've got decreased serotonin, dopamine. And nitric oxide is involved in the regulation of anxiety. Anxiety and depression, you see low levels of BDNF. Nitric oxide mediates the neuroprotective actions of BDNF, promoting neural survival, stimulating neurogenesis, enhancing learning and memory, plays a role in synaptic plasticity, which positively influences mood, increases GABA in the brain. So nitrates increase the production of BH4. So BH4, not only does it keep NOS coupled, BH4 is the essential cofactor in making your serotonin, your dopamine, your melatonin. So this EMF has all of these effects in the CNS by affecting the blood-brain barrier, memory, neurons, neurotransmitters. even genotoxicity and cancer. Circulation is critical for cognition. High blood pressure is a risk factor for cognitive decline and dementia. Even though our brain is only 2% of our body mass, it consumes 25% of our body's requirement for oxygen. The brain needs to be producing 20 times more nitric oxide than the entire vasculature. So if you're interfering with that, you're definitely interfering with cognition. So remember that hemoglobin requires nitric oxide attached to it to release the oxygen. When you're hypoxic, the mitochondria become uncoupled, superoxide is increased, ATP production is decreased. Remember that cytochrome C oxidase can become a nitrite reductase enzyme to increase the nitric oxide production, to open up that circulation, and it can do that without a decrease in the ATP production. And it affects learning and memory. So remember that they're all through the nervous system. You've got increased oxidative stress. You're impairing that blood-brain barrier, neuroinflammation, neurodegeneration. You got damage to the cerebral cortex. That's where our executive function is. Got degenerative changes in the cerebellum, apoptosis of the amygdala, damages the myelin sheath. Think about the explosion of MS lately. So in that influx of intracellular calcium ions disassembles that cytoskeleton, especially the microtubules, increasing apoptosis. And neurons are very, very sensitive to oxidative stress because they are long-lived cells and they don't renew as quickly as, like, say, our gut cells. EMF can increase pain. These voltage-gated calcium channels play a role in the development of chronic pain. That influx of calcium ions triggers apoptosis or increased inflammatory cytokines. And we know that inflammation causes pain and tissue damage. Activation of those calcium channels increases the glutamate, the substance P, activates the NMDA receptor, which plays a major component in inflammatory neuropathic pain, increasing pain in the CRPS, diabetic neuropathy. GABA can react with the voltage-gated calcium channel and decrease that neuropathic pain. Nitric oxide in the brain inhibits GABA transaminase enzyme to increase GABA in the brain. When you've got compromised circulation, you're not being able to deliver oxygen, glucose, and nutrients to these nerves, and they malfunction. And so you've got lower energy production, and this affects the membrane potential. So one of the pathways that morphine works on those pain pathways is through nitric oxide. So we've got these EMF affecting the the voltage-gated calcium channels, DNA, NADPH oxidase, the mitochondrial DNA from increased inflammation. EMF affects every single facet of our body, as well as nitric oxide. They're intertwined. Increase that EMF, you're decreasing the nitric oxide, nothing works right. So we've got this perfect storm for impaired nitric oxide production. Age, especially over the age of 40, physical inactivity, standard American diet, medications, antibiotics, the azole antifungals, SSRI antidepressants, birth control pills, NSAIDs, PPIs, achlorhydria, antiseptic mouthwash, fluoride and whitening toothpaste. These affect the microbiome in the mouth, which affect that nitrate to nitrite reduction, glyphosate, pollution, EMF, stress. So EMF increases oxidative stress, increasing free radicals. This damages membrane cells and tissues, altering physiological processes. You don't have to have heat, don't have to have a thermal process to cause damage. Oxidative stress and inflammation play a role in every single chronic degenerative inflammatory condition. Oxidative stress uncouples that NOS, decreasing nitric oxide, increasing oxidative stress further. Nitric oxide inhibits that calcium influx, which modulates even potential more damage. So supporting nitric oxide is the base of all health. It is the base of healing. It is not going to be the only thing you're going to be doing to somebody, but it should be the base. Because if you've got impaired circulation or microcirculation, doesn't matter what else you're doing, nothing's going to get to where it needs to go. So open up that microcirculation. Allow all these other things you're doing, all these other treatments to work. So supporting the nitrate to nitrite to nitric oxide pathway optimizes nitric oxide. It decreases oxidative stress and inflammation. So thank you very much. This is my little kitty cat. So here's my email. So, if we don't get all the questions answered here, just shoot me an email. I'll be glad to answer any questions.
Okay, well, thank you. Great as always, Beth. So the big question is, so what do we do about it?
Okay, we can increase our nitrate-rich veggies, our arugula, spinach, bok choy, cabbage, beets, or we can take a nitrate supplement. And I've formulated a wonderful oxalate-free nitrate supplement. Most nitrate supplements on the market have spinach or beets in them.
Mm-hmm.
And these do contain oxalate. So if there's some really sick people that don't want, that are kind of trying to get away from the oxalates. So I formulated a nitrate formula that has arugula. So there's no oxalates in it.
Okay. Does your research show both RF or Wi-Fi frequencies and magnetic fields, power lines equally harmful, or is one worse than the other?
They're all bad. They're all bad. Get a meter and you can actually see, where all this stuff is coming from.
Mm-hmm.
But years ago, Dr. Bob Marshall, who started Premier Research Lab, he was really good on mitigating EMFs. And since he passed, though, that whole hit all of his processes that were really cutting edge just kind of gone by the wayside. But he was really into using magnehematite to help interfere with some of these EMFs.
Mm-hmm.
He'd even go out and remediate some of these towers and stuff.
Well, Beth, just to add to that, because I guess hosted a podcast about EMFs. So Wi-Fi emission is actually gauged around 2.4 to 5 gigahertz, and power lines are basically 50 to 60 hertz. So that's why you really can see how powerful these things are. And as something astounding to me, WHO actually declared EMFs as potentially carcinogenic. So that's already a statement for you that they are recognizing this slowly.
Finally. Yeah, it's taken a long time. I mean, they've known this for 50, 60 years. They have known this. You know, like they started to figure this out when they had the submarines, you know, when they were trying to communicate with the people in the submarine. And so they used like these wavelengths. And all of these guys were coming down with cardiovascular disease and blood sugar dysregulations. So they've known this for ages.
Do you think we should wear tinfoil hats now?
Oh, well, how about, you know, how about supporting your nitrate to nitrite to nitric
Right?
oxide
There you go.
every single day? And if somebody's got a chronic issue, like get some of those saliva test strips so that you make sure that you have enough in your body like 24/7.
Well, to add to, so you can discuss your pathology of EMFs, you would see that there's a lot of production of ROS here. That's why
Yeah.
constant intake of antioxidants as well. That we already know that ACE, there's so many things along with our nitric
I
oxide.
think
Definitely is a good concoction.
melatonin is the star.
Right.
It's the star. The nitrate and the melatonin, that is the star for keeping down that oxidative stress. You know,
Are you in promotion of high doses of melatonin? Because there are theories out there that you will suppress your own pineal gland if you're taking
no. Doris Lowe. Do you know who Doris Lowe is? Follow her
No,
on Doris Loh. Follow her on Facebook. She
Mhm.
does. She posts these like she's a nitric oxide researcher. She is posted some studies she's done with Russell Ryder, the premier melatonin researcher. But she just like a couple of days ago, she posted a study showing that actually exogenous melatonin upregulates endogenous melatonin production. Because remember that slide that I had with the melatonin, that you can actually upregulate the production.
Right. Well, I actually do 10 milligrams, not only because I was jet lagged, but that's definitely something that I have seen in using cancer patients.
Yeah, I use like 60 to 70 every night.
Wow. Impressive.
But she said the people, like when you use higher doses, like she had a whole protocol during the virus. You know, vitamin C, melatonin, I added the nitrate to it, but some major doses of melatonin, you know, even, 1,000 milligrams. But she said the people that get too sleepy from the melatonin, they've got some mitochondrial work to do. So you've got to help repair that mitochondria, because once you get those mitochondria functioning, you're not going to get that sleepiness from the melatonin.
I think Stephen is raising his hand.
Okay.
Go
I
ahead,
had
Stephen.
my microphone muted. I've been using high dose niacin in pretty much every patient that crosses my path, about 21 years. And, as soon as it blooms, everybody complains about the hot flash. I don't actually like to mute it because it generates a ton of nitric oxide, a lot of vasodilatation, which can be a problem, especially if you administer it fasting, which you should never do. And then downstream, you get probably more NAD than the supplements provide in the bloodstream.
Right.
If you mute the hot flash, some of the benefits are still there, but you lose the PPAR system, alpha, delta, and gamma. And I try to transition them through it 2 weeks or 2 months. Everybody's different. So they learn to accommodate it. And the trigger's left intact, but the hot flash rarely occurs after 2 months or so, unless they provoke it. And I give them guidance to how to manage it. Take an Alka-Seltzer in your wallet. I wouldn't recommend that every day, but if you're out to dinner, it can be embarrassing. You have a few drinks and your face lights up,
Yeah.
But I have people call me 5 years later to express their pleasure that they remembered to have it in their wallet. They forgot it was there until they had a few drinks. Their nephew graduated from college and now it's a problem. But it does make a lot of nitric oxide. And Castelli was right. You shouldn't take it one bolus. You should take it every time you take food.
Yeah.
And then you offset the postprandial lipemia, and you're getting spikes on nitric oxide production 2 or 3 times a day.
Well,
I
that's
actually,
because you're making that NADPH. And
yeah,
that NADPH is
right.
giving the electron to your NOS enzyme. Yeah.
Yeah. Some people enjoy the flush. I got a couple guys, God bless them. They go to the gym and they take 3 grams on an empty stomach and work out. And they
Oh,
claim
wow.
they can go another half an hour longer. Who am I to judge? You know, but you know, they're compliant with the nice, and that's all I care about.
Yeah. You might want to add some nitrate to that too.
Yeah. There can be issues with, my wife has POTS, partial dysautonomia, women far more common than men. And when I first started using it in clinic, she took 500 milligrams and she was sweeping the floor and she basically passed out. And I still hear about it 20 years later, but she's Sicilian. What are you going to do? but I realized I'm doing everything wrong. So I kept reaching out to people like Guyton and famous lipidologists, and Castelli had the best advice. Only take it with food, divided doses, start them low, build it up slow. Nobody wants to go through the pain, but it does so many things beyond lipids.
Oh, for sure.
And the nitric oxide alone, your message, you know?
Yeah, I followed Abraham Hoffer a lot. He, you know,
Yeah.
and I even got to hear him speak and stuff. And he was a father kind of a niacin therapy.
Oh, it was so sad to see him pass, but I forget if it was him or Alchel had horrible malocclusion. That's how they made the discovery. They gave him powdered niacin. My understanding wasn't even tablets. Imagine spooning out raw niacin because it healed his gums. They were purple and bleeding. And the dentist decided, I'm not going to pull your teeth. They told him he was going to pull them, but not until he was on niacin and healed his gums. So somehow the lab work got to his partner who had the rabbit lab. I think it's before PETA, of course. And he was feeding him chow to induce atherosclerosis. And they noticed in, I think it was Hofer, his lab work, cholesterol and the triglycerides had come down. Well, that's all they measured back then was cholesterol and triglycerides. So he fed the rabbits niacin with their chow, and sure enough, their blood work improved, and they published it. But it was because of crooked teeth. It's a great story. I love that story.
So there's a question about whether there's calcium channel blockers have any place in your regimen.
Well, there are studies that show calcium channel blockers do work. They do downregulate like the EMF hypersensitivity. But however, I just showed you that nitric oxide regulates that intracellular calcium.
Right.
So why would you want to be on a drug when you can eat more vegetables or, you know, just support the nitrate to nitrite to nitric oxide pathway with no downsides? You know, why would, you know?
I'm asking the question that was in the chat. That's
No, I know, but that's, I'm
Don't shoot
just
the
saying,
messenger.
No, I'm not. No, I'm not. Don't get me wrong, but I mean, I'm a pharmacist, you know, I know drugs, you know.
Okay. Dr. Nerio, do you have some email online?
Yeah. So some questions here about, so you mentioned about so a little confusion, I guess, on their end about INOS, ENOS, and then there's another one. What are the good NOSes with the letters?
Well, they're all good NOSes. However, like your ENOS and your NNOS. ENOS is your endothelial NOS. This makes your nitric oxide mainly for your microcirculation and circulation. Your NNOS, your neuronal NOS. This is heavily prevalent in your CNS. And your INOS, inducible NOS. This makes the nitric oxide that gets it's stimulated by infection, inflammation. So your ENOS and NNOS make nitric oxide on an as-needed basis. Your INOS, this can get upregulated by infection, inflammation. However, remember I said that oxidative stress uncouples NOS. So when somebody's got an infection and stuff, and that iNOS is upregulated, what you're really upregulating is the superoxide production, not necessarily the nitric oxide production.
So it depends on the situation and how
Right.
they're getting stimulated.
Yeah, but the eNOS and nNOS, these are both calcium calmodulin connected,
Okay,
but iNOS is not.
right.
That just can get automatically upregulated with infection and inflammation.
Right. So you mentioned about a term a while ago, deuterium depleted water. Could you expound on that? And where do
Well,
you get this?
Yeah, I don't know. I just know a little bit of it, but I just thought it was fascinating to figure out that that's what the mitochondria is making, that deuterium depleted water. I know that so it's not like when you have the deuterium in water, it's kind of a heavier water. And so they don't think that it has it's as you know, like all of these reactions happen in an aqueous solution. And so they think that the reactions don't happen as well when you're full of deuterium. But it's real controversial. And there are some people selling that deuterium depleted water, but it's really, really expensive. And I've listened to them speak and I've tried it myself and I didn't notice anything. And it's hard to tell. But I just thought that was a real interesting fact though, that the mitochondria is actually making that.
They probably want you to buy more. Maybe that's
Yeah.
what.
It's expensive. Have you seen it?
No, I've heard about it. That's why
Oh,
I myself am curious about what it brings to the health table. Since you mentioned it, I think it was asked by the audience too.
yeah.
Okay, no overdosing on nitric oxide or
On
any
nitrate.
overdoses.
No, remember that study I showed you where that showed that, you know, go back in the slides and look at that that study that I showed you, that it showed that there wasn't any cytotoxic concentrations of nitric oxide. And so listen to this, like the DASH diet, dietary approaches to stop hypertension, has 1,200 to 1,500 milligrams of nitrate every single day. So that would be like taking like the nitrate product that I formulated, that'd be like taking 2 capsules 4 to 5 times a day to even just reach that. So if you've got somebody taking 2 capsules a day or 2 capsules twice a day because they're under a lot of oxidative stress, you're not going to OD on nitrate or nitric oxide. And go back and like that, the stuff that I talked about, the peroxynitrite. So that's the excuse that people always talk about, that nitric oxide combines with superoxide and makes peroxynitrite, and peroxynitrite is damaging the cells and tissues. However, that just, if you read those studies, they can't prove it. They all say, you look at the wording, they all say, we suggest, maybe, could be. They're not measuring the peroxynitrite. They're just assuming that it was there.
So basically, yeah, no overdosing, pretty safe, especially, yes, if you use their product.
Yeah, or, the DASH diet. It's got 12 to 1,500 milligrams of nitrate per day. And that's used as therapy for cardiovascular disease.
Right.
That's a lot.
That is. Stephen, raising his hand.
Yeah, I couldn't help myself. I have MTHFR 677TT. I inherited it from my mother and my dad,
too.
my brother and I both. When they
I'm
studied
homozygous.
yeah,
Homo-
exactly, the curse. But very
Irish
common in
curse.
autism and Asperger's and all that. I have
And
mild
Irish,
Asperger's.
yeah.
The Irish study on riboflavin is fascinating. I've been following every few years. They do follow up. I think they're into 20 years. McNulty, there's several of them at the University of Ulster. If you were homozygous versus heterozygous or normal wild type, those two latter groups, no benefit. But 1.6 milligrams of riboflavin and blood pressure came down systolic 8 to 12 points. Clearly, nitric oxide's involved there because you're greasing
Well,
the MTHFR enzyme wheel.
well, but you saw the picture where I had the NOS enzyme. Your
Yes.
your flavins are one of those electron carriers down
Yeah.
to your enzyme.
Yeah, and it does lower homocysteine a bit too. And in China, they did the CSPPT, all these sub-studies because it's a huge trial, long-term, not a lot of folate supplementation, folate. So they're largely depleting the Chinese population. And what was it? 0.8 milligrams, not even a milligram of folic acid, which isn't methylated folate, but
Right.
the stroke risk versus enalapril alone, adding that to enalapril in the treatment arm, 21% lower stroke. In the guys like me, the individuals with the homozygous defect in the 677, 74% additional reduction in stroke, and it benefited slowing down kidney disease and a few other things. Clearly, the folate's necessary.
Yep. Well, you've got to have that to make your BH4.
Yes,
And the
Yes,
BH4 is what keeps the NOS coupled.
right. I appreciated that part of your lecture. That was great. I wish I had the slide deck because I want to show some people that slide.
Well, they'll share the slides with
Yeah,
you.
we'll have it. We'll
Oh,
put it
great.
on our website.
Yeah.
Okay.
Yeah.
I'm new. I'm a first timer here, so I
Oh, well.
apologize.
Oh, good.
You're welcome. Man.
Okay.
I'm enjoying it. I'm tired, but I don't want to go to bed yet.
Okay. So this is our website, aosrd.org/webinars, and we put
Great.
all the videos. We've been here. This is October now is 4 years. We've been doing this. And we put the videos. Sometimes we'll get the transcripts and if we get the slides, we'll put them on there too. So someday we'll figure out a way to correlate, to capture all that stuff. And I think we'd have a pretty nice compendium of alternative medicine. So Dr. Quinn, there you go. There's your project. So
Wonderful.
okay. Well, John's not on tonight. You got any others there, Dr. Nario?
Yes, grounding. Is that something that can negate EMF?
It sure helps.
Mm,
Sure helps.
I
Yeah,
agree.
I've-
I actually saw
I've
studies
got a
on that.
grounding
too.
bed and a grounding mattress cover. Yeah.
Mm-hmm.
Yep.
That's definitely a yes on our end also. So yeah, walking barefoot, hugging on trees, holding on to plants. So this
Yep.
definitely negates it. But how long can you really do it, right? So
Well,
it's
that's
really
why I've got like a grounding bed with a grounding like mattress cover. So
right.
at least every night, then at least I'm grounding.
Yeah, and then also one thing here. So I also have work in the cancer center, and things that we see and theorize because we actually have patients who, for example, this is in the realm of breast and brain cancer, that a lot of our breast cancer patients, not a lot, but there's a good number of them. In the gym that they put their cell phones in their bras.
Oh, I know it. And on the
Right.
trail, I see that and I just go, ah.
Yep, that's we have quite a few patients who actually kind of vouch that, hey, it's probably that. But again, no proof on that. These are all anecdotal and just straight up from patients. And also gliomas. That
Yep.
is basically not, I mean, you don't see that on patients. That's on paper. That when you use cell phones on your head, that's why they promote speaker, right? Not putting your phones near your head. actually will prevent gliomas to form. So
Yep.
that's why if you want evidence, there's some there for you to see.
I'll never forget this one guy walked into the pharmacy one day and like people were always like pulling up their shirts and stuff like this. This guy pulled up his shirt and he goes, he had this big rash on his body, but then he's got his cell phone like stuck inside of his pants right there too. You know, he goes, but he pulled up his shirt and he's going, "What is this from?" I go, "Well, take that cell phone." Oh, what?
It's probably burning him up.
Exactly. Exactly. And then all these guys that have them in their pockets, irradiating their gonads. Not
I know, the jewels, right?
Yep.
Bill, that's it on my end.
Okay. Okay, so Beth, so I'm Archie Bunker. I'm gonna have a hamburger, French fries, and a Coke, no ice, a real Coke, none of this Coke Zero stuff for dinner. I got my cell phone in my back pocket or in my front pocket. I'm going to be up at 3 o'clock in the morning, looking to see what stocks I'm going to buy in the morning or Bitcoins, and so what do I do? And I don't feel so good.
Yeah, I bet you don't.
So where do I go? How do we counsel somebody, like Archie on how to proceed here?
They will take out the cell phone away from his body for starters. At least get him on a couple capsules, of some nitrate every day, because you're probably not going to get his diet changed overnight. And at least start getting that circulation going.
Mm-hmm. Okay. Are there any lab tests that you look for that tell you? I mean, other than the little saliva thing, is that your gold standard? The saliva.
Well, that shows whether you can reduce that nitrate to nitrite, and then if you take a couple capsules or you eat a big salad. Test before, and then take a couple capsules or eat a big salad, and then test like an hour to an hour and a half later. If you don't change that strip pink, that means your microbiome is disturbed. And so you start asking questions. Are you using mouthwash? Using fluoride or whitening toothpaste? Are you using like any antibiotics or even herbal antibiotics? But the beautiful thing about nitrate supplementation is you actually help rebuild those microbiomes. You're increasing the bacteria that reduce the nitrate to nitrite. So there have been a couple of people where it has taken them like a couple weeks of taking the capsules before we could start getting that pink to change. But I've seen people's fasting blood glucose come down, their hemoglobin A1C come down, the HSCRP come down, because you're decreasing the oxidative stress and inflammation. So you're going to see some of these oxidative stress markers, inflammatory markers come down.
Okay, great. Okay.
Oh, there's also black garlic, Beth. I don't think you know about this, right? H2S, hydrogen sulfide.
Yeah.
Another support for your nitric oxide formation.
Right. But then, you've got to make sure somebody's not producing a whole lot of that too.
Right. Like SIBO.
Yeah.
Mm-hmm. That's something to recommend Archie. Maybe he likes bad breath.
If somebody put a question, what do I recommend for SIBO? I actually formulated a product that's being distributed by the same people that are distributing my nitrate product that I initially called Bio5. It's got a prebiotic, a probiotic, a parabiotic, a postbiotic, and it's got bacteriophages in them. Do you know what bacteriophages are?
Mm-hmm. I haven't encountered them.
Okay, these bacteriophages I have in this product actually are effective against E. coli, Listeria, Salmonella, the 3 most common foodborne pathogens. So this product is pretty, there's nothing like this on the market to have those 5 combined together. So we're getting pretty good luck on that.
So the phages are now being developed, because before when I heard about it, they're being used to carry these strains. There's so many different bacteriophages that I heard before, but now this is a more developed, complete technology.
Yeah.
All right, it's awesome.
You'll name that later, right? Once your CM is off.
Yeah,
Yeah.
I think it's probably about time to name it. So, okay, so thank you so much, Beth. We've had a great time. And as you can see here in the chat for CME credits, there's the link. Click on that and answer a couple questions. It's $30, 2 CME credits, AMA category 1, aosrd.org/webinars for all the videos in the past. And most of the slideshows also. Sometimes there's transcripts. Also on YouTube, go to Clearfield Medical Group, and most of the videos are there. And we got monetized this week for the first time. Unbelievable.
Oh, yay.
Yes.
Oh, yeah.
I don't know what to do with it exactly, but it passed. So, okay, so we're going to say a good night for our CME portion.